Alhamdulillahi Rabbil Alameen. Hello to all my friends and colleagues and fans and students everywhere. Today I will speak about an important topic, which is clinical symptoms and signs, or symptoms and signs in clinical medicine. Of course, symptoms and signs are basic essentials for diagnosis. So you can't diagnose without having the symptoms or without paying attention and listening to the patient to know the symptoms he is suffering from. And number one, to know the complaint, that is the presenting complaint, and then to know the symptoms and the important positive and the important negative symptoms, even if the patient didn't mention specific symptoms. You have to ask about symptoms which are important positive and symptoms which are important negative in the diagnosis. Because as we all know, symptoms are subjective manifestations of the disease, which the patient is showing in clinical practice or is having in clinical practice. So the symptoms, they can be detected and they can be brought out from the history by patient's interview, from the clinical history or history taking. So we have to start clinical evaluation by history taking, sitting with the patient and listening to the patient in order to know, number one, the major complaint and the other complaints, and then what else he has, symptoms, as I mentioned, whether the positive symptoms or the negative symptoms. And as I mentioned, also there are important negatives which you should ask the patient to exclude in order that you will have an overview of the symptoms he has. So this is very important in clinical practice. And then you proceed to a bedside examination or physical examination to detect physical signs, which are objective clinical manifestations that the doctor can detect on clinical examination. So the manifestations which can be elicited from the patient's history taking are called symptoms, and the manifestations which are detected by physical examination or bedside examination is called signs. يعني هي اسمها الأعراض symptoms وsigns اللي هي العلامات الإكلينيكية. Both symptoms and signs so can be collected from history taking and physical examination, and depending on or according to these symptoms and physical signs, we can reach to the diagnosis, or we might proceed to investigate the patient, that to ask for laboratory investigations and or other investigations, maybe depending on the case and depending on the presenting symptoms and signs and physical signs. We can proceed to, in addition to laboratory investigations, we can ask for radiologic investigations, we can ask for endoscopic investigations, we can ask for pathologic investigations, we can ask for immunologic investigations and serology and immunology, we can ask for hormonal investigations in case of an endocrine or suspected endocrine problem, and other types of more sophisticated investigations. And then after that, we might reach to the final diagnosis, or maybe a differential diagnosis, or but the differential usually is the one is the primary possibilities which can deduct after the provisional clinical evaluation, that is the history taking and the physical examination. We have differential diagnosis, and then by the investigations we will reach to the final or definite diagnosis, and then proceed after that to medical or therapeutic treatment or therapeutic approach or therapeutic plan. So this is very important to know, and this is very basic in clinical medicine. But here I have to highlight an important issue in the clinical symptoms and signs. Is what we call that we have two types of symptoms and signs. We have what we call general symptoms and signs and local symptoms and signs, or we can say specific symptoms and signs and non-specific symptoms and signs. And we have also in the specific symptoms and signs, we have what we call hallmark symptoms and signs, or pathognomonic symptoms and signs, which can characterize or point to a specific medical condition or disease. So the non-specific symptoms and signs are those which are not distinctive, and they don't point to one disease or one condition or a specific medical condition or disease. So we call it general symptoms. Like, for example, the weight loss. It is a general, non-specific general symptom. Like fatigue, it is a non-specific symptom because it can happen with tens of diseases or thousands of diseases, the fatigue. Also easy fatigability, weakness, effort intolerance, malaise, prostration, fever. All of these symptoms, they are what we call non-specific symptoms. Non-specific symptoms. Exactly like for, when we examine the patient, and then we might detect also non-specific signs. That is signs that, or those signs which are not specific, or they don't point to, or they don't indicate a specific medical condition or disease. Like, for example, in the general signs, the loss of weight. Loss of weight can happen with many chronic medical conditions. So, loss of weight. And here, the extreme loss of weight can highlight or make the diagnosis of cancer or malignancy more probable, for example, but still it's not specific. So generally, the weight loss is non-specific general sign or a non-specific symptom. Also, the jaundice is non-specific. It might be due to liver disease, might be due to a hemolytic condition or a hemolytic disease. It might be due to an obstructive pathology with obstructive jaundice, so it is rather non-specific sign. Also, skin rashes. Many types of skin rashes, they don't point to a specific medical condition, like we have papillary skin rashes or pustular skin rashes, or they might be point to a specific group of medical conditions which still need to be sorted out. Which one? Because we have many conditions causing pustular or vesicular skin lesions. We have many conditions which might cause papillary skin eruption. We have many conditions which might cause macular or maculopapillary skin eruption. We have many conditions which might cause plaques. We have many conditions which might cause wheals, and all of these are skin rashes. So skin rash is rather non-specific symptom and sign at the same time. Also, lymph nodes, whether localized or generalized lymphadenopathy or lymph node enlargement, it is rather still non-specific because it indicates or it shows or it enters into the differential diagnosis of many conditions. So there is many differential possibilities if we find lymphadenopathy. So skin rashes, lymphadenopathy, jaundice, still they are non-specific physical signs. So this is what we call the non-specific. But now we come to the specific. Specific, when we say specific symptoms or signs, this means that there is distinctive symptoms or signs that will indicate or that point to a specific medical condition or disease. And this is very important. This we call specific symptoms and signs. And here, for example, when we say that the patient is having a symptom like a severe chest pain, this might be due to also severe chest pain is a symptom, but severe chest pain may narrow the possibilities. Number one is the acute coronary syndrome, like acute myocardial infarction, might cause severe chest pain. Also, aortic dissection or dissecting aortic aneurysm might cause severe chest pain. Also, massive pulmonary embolism might cause severe chest pain. Lung collapse might cause pneumothorax, especially tension pneumothorax might cause severe chest pain. So there is still many conditions, but it will narrow the spectrum of possibilities of the chest pain when it is severe, because not any condition can cause, not any chest or cardiopulmonary condition can cause severe chest pain. For example, pneumonia may be associated with chest discomfort, but it's not severe chest pain. Also, other than pneumonias or lung infections, pulmonary embolism, especially small pulmonary embolus or a medium-sized pulmonary embolus, will not cause severe chest pain. It might cause chest pain, yes, but not severe. Severe point more to massive pulmonary embolism, especially if it is oppressing severe chest pain and associated with shock and cardiovascular collapse. Here, the possibilities is either tension pneumothorax or massive lung collapse or acute myocardial infarction or dissecting aneurysm, because this is only the group of conditions which might present with severe chest pain associated with dyspnea and maybe cyanosis and acute dyspnea and the cardiovascular collapse even. So here it might point to a specific condition or narrow the spectrum of differential diagnosis to 2 or 3 medical possibilities which can cause this severe, for example, chest pain. So here the severe chest pain, for example, it is rather relative specific symptom. Also, same like headache, same like abdominal pain. So this is the specific and non-specific. And also we have to beware of what we call the warning symptoms and signs. Warning symptoms and signs. And the warning symptoms and signs, maybe these are symptoms which indicate an unusual hazardous medical condition, an unusual hazardous medical condition, or an unusual complication of a specific disease. So it is that's why it is a warning, because it is a manifestation of some pathology which is serious pathology, and this serious pathology will cause an imminent life-threatening complication or life-threatening medical. So it indicates, the warning symptoms and signs indicates a serious pathology which is potentially hazardous and is an imminent manifestation of an imminent life-threatening medical condition, which might even be fatal if the medical staff did not properly at the proper time pay attention to it and start medical intervention or investigations and to reach to the diagnosis, and then immediately start treatment or therapeutic plan. For example, in the emergency room, or even before that, and in the emergency room after diagnosis, to give the emergency medications and then transfer the case to the ICU or the CCU. So this is the warning. So the warning, because it indicates a serious pathology which is potentially hazardous and is pre-monitoring of an imminent life-threatening condition which threatens life and may be associated with high morbidity and even mortality if not paid attention to it. For example, and these are many in clinical medicine, like sudden severe chest pain. This is a warning sign. And the warning signs, by the way, may be either pointing to emergency condition or might be also number 2, pointing to a concerning, what we call concerning symptoms and signs, which need you to see the doctor as soon as possible, but not emergency, but not as emergency. So they are classified into 2 grades, either warning signs of an emergency medical condition or warning signs of a concerning medical condition, which needs medical attention as soon as possible, but not as an emergency. Like the difference between hypertensive urgencies and emergencies versus severe hypertension, which is not reaching to the level of emergency or urgency, but also it needs medical attention and treatment as soon as possible, because if not treated, it will soon develop into or be complicated by a hypertensive emergency, which is threatening a serious pathology with which is potentially hazardous and is a life-threatening medical condition if not properly given a medical attention. And this, like sudden severe chest pain, it is a warning symptom and sign. It's a warning symptom. Sudden severe chest pain, sudden severe headache, and also a headache which is progressively increasing, if not severe from the beginning, but it is progressively increasing and is associated with other serious symptoms like confusion, disturbance in consciousness, like vomiting, etc. So sudden severe headache, it is very dangerous, it is warning. Also sudden confusion, sudden disturbance in the content or in the level of consciousness, sudden fainting to the ground, sudden also syncope, it is a serious medical condition, it is a warning symptom and sign, which is a sudden transient loss of consciousness, syncopal attack. Also, this is a serious and a warning symptom and sign. Also, bleeding from anywhere, gastrointestinal bleeding, whether, especially if it is a moderate bleeding or severe bleeding, this is serious and warning, and this is red flag, what we call red flag symptom and sign. Also increasing abdominal pain which is sudden and severe abdominal pain, or sudden abdominal pain which is progressively increasing, especially if associated with repeated vomiting and or absolute constipation. This also is a warning symptom. And also severe bleeding, as I mentioned, also a swelling of the leg, which is progressively increasing, maybe DVT, which needs a serious medical attention and initiation of anticoagulation because of the possibility of thromboembolism. And also sudden disturbance in speech, sudden weakness in limb, sudden disturbance in gait might indicate a cerebrovascular problem. So this is also unexplained weight loss over a few weeks. So this is unexpected rapid weight loss might indicate a serious medical condition. You should visit the doctor as soon as possible. This is a concerning symptom, and you should visit the doctor, as it's not just loss of weight which is has progressed over months or years. No, it is sudden severe weight loss which is of short duration and happened over the last few weeks, for example. So this is unexplained severe weight loss, needs a medical attention. Also, this is a warning symptom and sign. So these are and also, as I mentioned, bleeding, also high fever. This is also a warning symptom and sign, especially if associated with other medical symptoms and signs. So high fever, sudden severe bleeding, sudden severe headache, sudden severe chest pain, sudden severe abdominal pain, which are associated with other symptoms and signs. Also sudden or troublesome breathing, that is sudden acute shortness of breath or acute dyspnea. It needs immediate medical attention. Acute dyspnea, acute shortness of breath. So all of these are called warning symptoms and signs, or sometimes we call red flag symptoms. And that's why we always search for the red flag symptoms and signs in patients with headache, we should search for them. Patient presenting with, especially with acute headache or sudden headache, you should look for the red flag, other associated red flag symptoms and signs, because this will indicate serious pathology, and the medical team should interfere quickly. Diagnosis and treatment and start initiation of treatment, or the patient might die, and there is increasing, it's life-threatening, there is increasing morbidity and mortality. So be careful and beware of the symptoms and signs, the specific and non-specific, and the warning symptoms and signs, and the red flag symptoms and signs in clinical medicines. Next time I will talk about a lecture for common specific signs in clinical medicines. It's only for specific signs which are useful for diagnosis of specific medical conditions. This is my next lecture. Professor Dr. Tarek Ali.